I'm Dr. Dave Janda. Welcome back to our Operation Freedom Health and Wellness series with Dr. Peter Gladden. This is a very unique presentation in that we have one of the top, if not the top, naturopathic physician in our country, that being Dr. Peter Gladden, with an unholds-barred discussion with an allopathic physician, an MD, retired orthopedic surgeon, Dave Janda. This is something the medical industrial complex does not want. You see, they want us divided. They don't want a naturopathic physician presenting information with an allopathic physician in harmony, if you will, as opposed to divided, because ultimately it leads to your empowerment. So you don't have to use the medical industrial complex system, that being going to the doc, going to the hospital, using their insurance products, buying their pharmaceutical products. This is their nightmare. And frankly, it's your salvation. Because through education comes empowerment, and with empowerment comes health and wellness. And that's what our entire series over 5 years now has been about. Our archives are available at davejanda.com. We have our information at OperationFreedomHealth.com. Dr. Gladden has provided a free video at OperationFreedomHealth.com on the 12 bad foods you should avoid as a basic foundation for getting on that health and wellness train, if you will, to freedom, healthcare freedom. Today's topic is going to be about calcium deficiency and high blood pressure. Now, Dr. Gladden, in addition to being a fantastic naturopathic physician and researcher, is also a great author. His books, Everybody is Sick and I Know Why, and Attempt a Cure with Holistic Medicine, are available through his websites, drgladden.com and leavebigpharmabehind.com. I'd like to tell you they're also available on Amazon, but he got Deep Six by Amazon because, well, it's controversial when you talk about health and wellness and don't actually push big pharmaceutical products. Oh, no, you can't have that. I encourage you to get those books. And all the products, full disclosure, we discussed today are available, including extra information on OperationFreedomHealth.com. We've recently revised the website so that it's a little bit easier, if you will, to utilize to get all of your educational needs as it relates to health and wellness. We have now, toward the middle part of the homepage, a section about, well, the right supplements for you. And we have a wellness assessment that you can put the information in to see exactly where you're lacking when it comes to your nutritional well-being. We have a specific concern area about, okay, well, I have high blood sugars, and we have specific topics related to that as well. I encourage you to go to OperationFreedomHealth.com. The purchase of the products there does support this platform so we can continue to bring this information to you. It's my honor to welcome back Dr. Peter Gladden. Pete, welcome back.
David, it's always a pleasure to be with you, man. Getting the word out for everyone who has ears to hear, because people, I tell you what, after doing this for 35 years, I'm here to tell you that most people who are laboring with a chronic disease are suffering needlessly, simply because all they have access to is pharmacy, surgery, right? And surgery, when it's necessary, is a godsend. But pharmacy, you don't get high blood pressure because you have a lisinopril deficiency.
So Pete, I've mentioned before when I finally got it through my thick skull with my arthritis to go on the nutritional program you had suggested with the foundation pack. I ended up getting rid of all the anti-inflammatories I was on, including even Tylenol and everything. I mean, everything, right? The whole shooting match. And been active without difficulties. At the same time, I also had high blood pressure, hypertension.
Oh, I didn't know that.
Yeah. So, and they had me on a low dose of a medication for hypertension.
Yeah.
Well, one of the other side effects of treating my arthritis from a nutritional standpoint and getting off all anti-inflammatories was I noticed that after I was on the foundation pack for about a month, I noticed that when I stood up quickly, I get a little lightheaded.
Yeah.
I'm like, so I was checking my blood pressure and going, what's going on with my blood pressure? My blood pressure is incredibly low. What is going on here? Right? I mean, so I said, this is called orthostatic hypotension. When you stand up and then you feel a little, woo. So I gradually stopped my hypertensive. Now, the only thing that had changed is going on the foundation pack, which includes the best calcium nutritional product on the supplement on the face of the earth because of its bioavailability, and I know you'll get into that. But Pete, in addition to my arthritis problem, my blood pressure problem became, you don't need any, even though it's low dose antihypertensive anymore.
Yeah, because you were not hypertensive because you had a pharmaceutical deficiency.
No.
You were hypertensive because you had a nutrient deficiency.
Well, I was told, you're in a stressful day. If you're a surgeon, you have a lot of responsibility. You're doing all this, you're doing the policy stuff. It's a stress thing.
Yeah.
Well, maybe there might have been. There was stress, but Pete.
Yeah. So life is a great big bowl of stress, and this is just, where the educational component of this comes into, right?
Yes.
And I've always said this, that the education of an MD generates, the metaphor that I like to use is colorblind artists who don't know that they're colorblind.
Yeah, no, that's true. That's not being rough. That's not being tough. It's being honest. That's very true.
Yep.
Yeah.
So in this little metaphor, right, they're going to paint a picture of me and my family, and it's going to look like us, but all the colors are going to be wrong.
Yeah.
Every single solitary time. The only time that they get it right is when they paint with black and white.
Mm-hmm.
Then it's perfect. Mm-hmm. That's why in MD land, trauma care and surgery is perfect because it's the epitome of reductionism.
Mm-hmm.
Now, I will make the argument that if all you have is a hammer, everything looks like a nail. And
right.
Most of the time, if a surgeon tells you need surgery, you really don't. But that's the surgeon's knowledge base. That's all that they know. Mm-hmm. That's all that they've been taught. And so the medical professional doesn't know anything about medical nutrition, zero.
True.
And so they have no understanding of this whatsoever. And so, you get high blood pressure because you've run out of calcium and magnesium. Mm-hmm. And they throw a drug at it,
yep,
which only manages the problem. Meanwhile, your calcium and magnesium deficiencies are still there.
Right.
And oh, by the way, as your body metabolizes the drug, it burns through calcium and magnesium. Mm-hmm. So the presence of the drug in your system accelerates your nutrient deficiencies, which makes the original problem worse. So you need a stronger strength of the drug or a second or a third blood pressure medicine. And it happens all the time. Mm-hmm. So you get a clue, you nutrify your body, you fill the tank up. All of a sudden you've got normal, healthy blood pressure. And if I give somebody with normal, healthy blood pressure a blood pressure medicine, they're going to get orthostatic hypotension because their blood pressure is going to be too low. Mm-hmm. And, this is not rocket science. It makes sense when we talk about it out loud, and it's like, well, yeah, why doesn't everybody do that? Well, I'll tell you why everybody doesn't do that. It's because of the medical monopoly.
Yes.
And, we can't say it enough. A patient cured is a customer lost. So
very true.
It's not in the interests of the pharmaceutical juggernaut to cure anything.
No.
So they don't. And we go from bad to worse. And then, the older that you get, the sicker that you get, the more drugs that you're on. And then you go bankrupt. Leading cause of bankruptcy in the U.S. is medical bills. Mm-hmm. And then you die before you should, from all of this mismanaged disease management. And it's not healthcare, it's disease management.
So to those people that say, okay, so if calcium's related to blood pressure, and I got high blood pressure, if I just take a bunch of calcium pills, right? Well, boy, that's gonna fix my blood pressure. No, so Pete, educate our listeners about this issue.
I love talking about this.
Yeah.
I talked about this at length in my first book, mm-hmm. which is called Everybody is Sick and I Know Why, which you can still get at Amazon, by the way.
Yeah, it's the Attempt to Cure one they took down, right?
Yeah, they took it down. Yeah. I'm still getting an online publisher, print-on-demand publisher, so that should be up and running next week. And we are going to roll out a second edition of that book anyway. So, but here's the deal, okay? So you go, you get a clue and you think, all right, I don't have enough calcium. Okay, great. So you do a Google search and you see that the recommended daily allowance for calcium is 1,200 milligrams. Mm-hmm. Now, what you don't know is that the recommended daily allowance number was generated by really bad research that was done right after World War II on 20-year-old sailors. And so it wasn't the best group to pull from. And so they basically pulled the RDA for calcium right out of their rear end, and for all the vitamins, quite frankly. Mm-hmm. And then it became reality by consensus, because conventional medicine, the research that they do on medical nutrition is minuscule. Mm-hmm. So if somebody tells you they know what the RDA for anything is, they're lying, because nobody knows what the RDA is. Mm-hmm. Now, even if we did know what the RDA was, let's say the RDA really is 1,200 milligrams of calcium a day. Okay, so how much does a 30-pound young boy need? Is it 1,200 milligrams? How much does a 300-pound male need? Is it 1,200 milligrams? How much? The veterinarian industry has compensated for the size and the weight of dogs and cats and household pets for, 60 years now.
But not humans.
But not humans.
No.
So, number one, the RDA is just a crock of crap. Number two, it's not how much is in the capsule. Mm-hmm. It's how much you actually swallow.
The bioavailability.
Yeah.
How much you take in. How much you absorb.
All right. So let's say, you go to the health food store, you're excited, you got to get you some calcium. So you talk to the health food store clerk who doesn't know anything about anything because they don't have any education in it. But the health food store clerk knows business. So they see that you're excited, and they're going to take the little gold key out from the register. They're going to walk you over to the special cabinet that has a lock on it where the super duper uber German calcium supplement is kept, the one that Sally Field would take. Mm. And they're going to give you that bottle. And it's interesting, right? Because if you go to the health food store, you're going to see like 20 different types of calcium.
Right.
And it's going to be anywhere from $6 a bottle to $46 a bottle. And what the heck? So, the business owner is going to try to pitch you the most expensive bottle. Okay, this was developed in Germany by the PhDs in medical nutrition. They know what's what. Okay, great. So you buy it. So it says per capsule, 600 milligrams of calcium citrate. So you can do math. 600 plus 600 is 1,200. So you're going to take 2 capsules a day. Okay, and you're going to get all the RDA that you need. Well, in one 600 milligram cap of calcium citrate, there's about 300 milligrams of calcium. 300 milligrams of citrate, and I'm making these numbers up, but it's an approximation that's pretty good. So there's not 600 milligrams of calcium per capsule, there's 300. Mm-hmm. But because of the form that it's in, an encapsulated form, you're lucky if you can absorb 10% of it.
Which takes you down to 30.
It takes it down to 30 milligrams per capsule. So the RDA of absorbable calcium, the RDA is 1,200. So
you need 40.
You need to swallow 40 capsules a day.
Yeah.
There's 60 in the bottle.
Yeah.
So you're just out of luck from start to finish, and it's not because of anything other than lack of education, right? So this is a very important point, and not even Harvard knows this. Okay, I just pulled up Harvard's website. Harvard Health Publishing, which is an axillary of Harvard Medical School. Here's what it says. Key minerals to help control blood pressure.
Oh.
Calcium, magnesium, and potassium
there you go.
are necessary to maintain high blood pressure. Harvard says it. Harvard says it. Okay. However, here's what also Harvard says. It's usually best to get your calcium, magnesium, and potassium from food. Are you getting enough? Then they go through the whole RDA thing. And here's what they don't understand. Calcium and magnesium, and in this regard, potassium, are minerals.
Yep.
Plants can't make minerals.
Right.
Animals can't make minerals.
Nope.
The only way that calcium gets into the cow's milk is if there's calcium in the soil that the grass is growing that the cow eats. Or if the farmer puts a calcium supplement in with the food that they're feeding the cow. If there's no calcium in the soil, or if the soil is grown with herbicides, which restrict the absorption of the mineral into the body of the plant, there isn't going to be enough calcium in the plant to feed a fly. So thinking that you can get all of the calcium that you need, or the magnesium, or, by the way, any of the other 58 essential minerals, there are 60 essential minerals, from food is a fool's errand. You can't do it. It's impossible. It's not just improbable. It's not just difficult. It's impossible. Because the minerals have to be in the soil. There have to be the full complement of all 60. The plants that are grown in the soil have to be herbicide free. And that just doesn't happen. There is no place in the world that we're aware of so far where all 60 minerals are found in the topsoil. They're not. Minerals are in a patchwork quilt. I've got a map, again, from Harvard University on the website that shows the deposition of selenium in soils all over the country, and there's more places that don't have selenium than places that do. So this is a big disconnect in our educational system, right? So, yeah, you need calcium. Yeah, you need magnesium. Yeah, a plant-derived mineral, hands down, is the best form of mineral, but you can't get it from food.
No.
Because it's not in the soil. A little bit is, but you don't know how much. And what are you going to do? You're going to get a spectrographic analyzer and put it in your kitchen and, shred up the kale and see how much calcium's in it? You're going to do that? No, it's nonsense. So the easy workaround for this is just take a really, really good calcium supplement. Now, the next thing to consider in this regard. So, by the way, calcium helps the blood vessels to constrict and relax. Magnesium helps the blood vessels to relax. You need both. But, oh, by the way, those are 2 of the 90 essential nutrients. So you don't just need absorbable calcium and magnesium to have optimal blood pressure. You need absorbable calcium and magnesium plus 88 other nutrients. Because the nutrients work in concert in the body. And if you don't have the full spectrum of all of the nutrients, there's going to be an imbalance that's generated there. We saw this during COVID all the time. There was a big cataracts were popping up all over the place after COVID because people were aggressively supplementing with zinc, just zinc all by itself, just zinc, mega doses of zinc, to the exclusion of the other 89 nutrients. So when you do that, you're going to upset the apple cart. You're going to cause an imbalance, and cataracts are the result of that. We saw that all of the time. So we are not advocates of fractionated nutrition, which is what that would be. Just take calcium, just take magnesium, just take zinc. Well, it's a bad idea because you need all 90.
That's right.
And when you take all 90, that's when the magic happens. And I'll tell you about the magic. Out of 10,000 people that we surveyed who did the foundation pack, the 90 essential nutrients, 8,300, 83%, 83% had a remarkable positive experience with whatever health condition they had. Didn't matter what it was. It was high blood pressure, was eczema, was depression, was whatever the heck it was, went away. 83% just from the foundation pack. Now, how can that happen? Because the human body knows how to fix itself. The human body wants to fix itself. The human body's trying to fix itself, but it needs help. There are 90 nutrients that the body needs, but it can't make them. These are the essential nutrients, and you have to swallow them. They have to go down the hatch. It's mandatory. And when you give the body everything that it needs, for the first time in your life, switches start turning on that you didn't even know were turned off, like happened with you. No more arthritis. Oh, and by the way, the side effect, the healthy blood pressure. Wow.
And Pete, you talked about the bioavailability in the foundation pack. In addition to with the 90 essential nutrients and minerals, there's the what's called the OsteoFX portion of it. The bioavailability, your body's ability to absorb that particular compound, is extremely high. Correct?
Yeah. So there's a secret patented process that happens to the calcium in the manufacture of the Beyond OsteoFX. It's a trade secret. And it renders the calcium over 90% absorbable, which is huge.
As opposed to what we might see with others, such in the 30% category or 10% 10% category. Yeah.
10% if you're lucky.
Yeah.
So it's a big deal. This one particular supplement is one of the most effective nutritional supplements. I don't care, vitamin supplement, mineral supplement, fish oil supplement, whatever the hell, one of the most effective supplements I've ever seen. It's like the king. And it makes sense, right? Because there are 60 minerals that the human body needs. Right. 60. Of those 60, the body needs more calcium than anything else. I mean, just look at your skeleton, right?
Right.
Your body needs calcium not only for healthy bones and teeth, but for hormone production, for heart regulation, the beating of the heart, for relaxation and excitation of muscles, for relaxation and excitation of blood vessels. Your body needs calcium for a lot of things. It's the number one mineral nutrient that you need, number one. It's way out in front of everything else. And this calcium supplement is the most absorbable calcium supplement I've ever seen. And I've been doing this for 35 years. So I would argue, I do argue, that everybody, and by everybody I mean everybody, is nutritionally deficient with an emphasis on calcium. And people have habituated to being nutritionally deficient. So they think that it's normal to get stiff joints when you get older. They think that it's normal to have low back pain. They think that it's normal to have high blood pressure. They think that it's normal to have heartburn. They think that it's normal to grind your teeth at night. They think it's normal to have, 8 different cavities in your teeth as you grow older. People just think all this stuff is normal. Menstrual cramps, it's normal. Just shut up and, take your Midol, for goodness sake. But all of these things are caused by calcium deficiencies. So when you start to fill your tank up, a lot of things improve that you had gotten used to. And this is, honest to God, David, this is the best kept secret in the 21st century of medicine. I mean, an 83% success rate with a generic treatment it's unheard of, and that's what we deliver.
So, Pete, for further information, folks can go to OperationFreedomHealth.com. The products we discussed, the Foundation Pack and the like, the calcium supplement and the like, are all available on OperationFreedomHealth.com, including a wealth of information as we outlined earlier. Pete, educate our listeners on leavingbigpharmabehind.com.
I like the ring of that, David.
Yes. Yeah. It is.
Look, thank God for insulin. Mm-hmm. Thank God for lidocaine. Thank God for general anesthesia.
Right.
But it's not the drug, it's how it's used. Yep. And you don't get chronic disease, you don't get high blood pressure because you have a lisinopril deficiency.
No.
Right?
Sure. Right.
So the information at leavebigpharmabehind.com is based on 35 years of my clinical experience and that of my colleagues. It represents thousands of hours of clinical experience, not only of my contemporaries, but also of historical naturopathic physicians. It's what we have actually seen work clinically that I bring to the table, educate people about by way of self-help health recovery. Because sometimes you need a private appointment with a doctor. Mm-hmm. Sometimes you do. But most of the time you don't. Most of the time you just need someone to tell you what to take, how to take it, when to take it, what food not to eat, and line it up for you. Mm-hmm. Right? And it's like one of my favorite teachers said, I don't want patients, I want students. So I want to teach people how to help themselves. And that information, which is all clinically verified, is available at leavebigpharmabehind.com. You should check it out.
Pete, I'd like to thank you for everything you have done, are doing, and will do. I'd like to thank you folks for joining us. Again, OperationFreedomHealth.com, LeaveBigPharmaBehind.com. Until next time, Dave Janda signing off. Dream big and dare to fail. Thanks for your time today.